Pop quiz. You're caring for an 83-year-old patient with congestive heart failure who's taking digoxin. Which of the following signs of digoxin toxicity should you assess for? 1. Disorientation. 2. Weight gain. 3. Constipation. 4. Dyspnea. And the correct answer is 1. Disorientation. So this patient that's getting digoxin, one of the very first signs and symptoms of dig toxicity, that patient's getting way too much digoxin, is going to be change in level of consciousness. So you may see confusion, disorientation, lethargy. Those are one of the first signs and symptoms that you're going to see. Now, as a student, I know you were looking for blurred vision. Yeah, I know you were, but guess what? NCLEX is not dumb. They know by now you know blurred vision. This question was asking about not a sign of dig toxicity, but one of the first signs of digoxin toxicity. And again, what you should expect to see is a change in cognition, a change in how that patient's thinking, their level of thinking, okay? Now let's look at the wrong answer choices. 2, weight gain. If that patient's gaining weight, that digoxin most likely is not working. It's not doing the job, because think about it. What is our number one indicator for us to know like how much fluid the patient's holding on to? Is daily weight. It's not skin turgor. It's not INO. It is daily weight. So if that patient's gaining weight, something's wrong. That med's not as effective as we need it to be. 3, constipation. Actually, if the patient was getting too much digoxin, we expect to see the opposite, diarrhea, not constipation. And then 4, dyspnea, difficulty breathing. That is another sign that medication is not working. We're giving that patient digoxin. If that patient is experiencing dyspnea, what do you think is happening? First of all, let's take a step back. Let's talk about why they're taking digoxin. What's happening to this patient? They're having congestive heart failure. They're holding on to way too much fluid. The heart cannot handle all that fluid they need to pump out to the body. That fluid's got to go somewhere. Where does it end up going? To the lungs. So that patient start having difficulty breathing, shortness of breath, crackles in the lungs, all that good stuff. We're thinking left-sided heart failure. So we see difficulty breathing. That patient's condition is getting worse. So that digoxin isn't as effective as we would like it to be. So the correct answer, because I'm totally getting off course, but the correct answer when it comes to one of the first signs and symptoms of digoxin toxicity is going to be change in level of consciousness, such as disorientation. Something else I want to mention to you about, not specifically this question, just questions period. When you get a question and they tell you the patient's diagnosis, but they also tell you a medication. So they tell you patient's diagnosis and they tell you that you're about to give a medication or you just gave a medication. Don't focus on the diagnosis. That diagnosis is